advanced interatrial block can predict all-cause mortality. Interatrial block is an ECG indicator which consists of P wave with a duration exceeding 120 meters per second. It is related with atrial remodeling and thromboembolism, which can lead to embolic stroke and can increase mortality. The aim of the study was to evaluate the association between interatrial block with the all-cause mortality in ischemic stroke survivors during the first 10 years after stroke. Individuals who had accessibility to sinus rhythm ECGs with presence of P wave suitable for analysis and who were registered in Lund Stroke Register were included in the study. Patients who had non-sinus rhythm at time of admission for stroke and whose ECG was of improper quality were excluded from the study. A total of 235 subjects were included in the study. The patients were then divided into 3 groups based on the P wave duration, namely, no interatrial block, partial interatrial block, advanced interatrial block. All-cause mortality of stroke in the subjects was assessed via the link with Swedish causes of death register. The association between interatrial block and all-cause mortality in ischemic stroke survivors was calculated. The predictive value of interatrial block was evaluated in intermediate and high cardiovascular risk patients. Advanced interatrial block predicted the all-cause mortality better than partial interatrial block. By the use of multivariate Cox regression analysis, advanced interatrial block closely predicted the all-cause mortality than partial interatrial block in the intermediate cardiovascular risk patients. However, the accuracy of interatrial block association with all-cause mortality of stroke was not clear in the patients with high cardiovascular comorbidities. From the study results, it was concluded that advanced interatrial block closely predicted the all-cause mortality in the intermediate cardiovascular risk patients when compared to the partial interatrial block.